I decided on the title Patients Helping Patients because that is what we do on a daily basis. April last year, my local TD, John McGuinness, arranged a briefing session in Leinster House. There followed a meeting with the Health Minister, Leo Varadkar, in May. Patients representatives from around the country attended, and how upsetting that meeting was. We were all absolutely left in tears. Following on from that meeting, I received an email from the Health Minister last December who said, "Thank you for your recent letter. I have already met with patients and their families about Lyme disease. I explained to them that chronic Lyme disease and treatment with long-term antibiotics is controversial and is not supported by most experts, nor any of the various specialist colleges. Well, I reckon leaving patients undiagnosed, often misdiagnosed, is more controversial."
When you get a tick bite, whatever's in the saliva of that tick can end up in your body. So it can be the Lyme bacteria, but it can be 10 different bacteria as well, okay? Just like when you get a mosquito bite, it's not always malaria, right? It could be dengue virus, it could be chikungunya virus, it could be Zika virus. Don't get hung up on Lyme. It's Lyme and co-infections. It's a bacterial infection that gets into your system and causes trouble. That's really the important thing and makes you very unwell.
Symptoms can often mimic other disorders like arthritis, fibromyalgia, chronic fatigue, MS, Parkinson, and many more. Less than 10% is officially reported because symptoms can be very different. Only for Borrelia we have many different strains, but beside Borrelia we have the infections and we have the reactivating co-infections. And less than 10% is officially reported because we have many problems beyond the infection. It's not just an infection, but we generate a lot of disabilities. Immune system imbalance, inflammation, it's one big inflammation. Our detoxification is suppressed. We have often hormonal imbalances, leaky gut, and impaired brain function with cognitive problems and memory problems, and our mitochondrial activity, our energy systems are reduced. So Lyme is certainly a multifactorial disease.
So Borrelia can do everything in your body, that's a problem. But the symptom itself is unspecific, but the more symptom you have for an illness, that makes it more specific for this illness. We work in the whole medical world in this principle. So the doctors have to learn about, we name it symptomatology. What can Lyme disease do in your body? What can Borrelia do? And to accept this, what the patient is telling you. If you don't accept this and you say you have a psychiatric problem, then you exclude the possibility of chronic Lyme disease. And this is not what we have learned at universities, my generation definitively not. And Dietrich did this slide some years ago. He said 90% of chronic fatigue patients are Lyme positive. Most fibromyalgia patients are Lyme positive. By a study, Borrelia can cause Parkinsonism. You all heard about Michael J. Fox, for example. 20 to 30% of autistic disorders, autism, can be caused by Borrelia, and 58% by Mycoplasma. Multiple sclerosis, myelopathies, we come here to brain tumor, encephalopathies, we come to meningitis, neuritis, mania, depression, everything is described. I had a patient, it's now 11 years ago, the patient was 43-year-old, suffering 3 years from paresthesia of the left leg, 80% blindness of the left eye, progressive myalgia, recurrent dizziness, and very important for the socio-economical cost, the substantial loss of stamina. The diagnosis that time, 11 years ago, was multiple sclerosis. So a lot of neurologists, they say patients have multiple sclerosis without looking for chronic infections, for example. It's easy to do. It has consequences, so the patient was treated by corticosteroids, immune suppressive medicine, but the symptoms got bad, and the patient was nearly dying by multiple sclerosis that time. And the spinal fluid and every laboratory test were all negative. No antibodies, ELISA, although spinal fluid completely negative. That was the first time I did this ELISpot test where Dr. Lambert talked about, and the patient was full active in all 3 antigens, and also the CD57 cells this important to measure in chronic neuroborreliosis was 40 per microliter. So that patient, nowadays I would say that for me it's clear, it's a sign for recent activity against Borrelia and chronic activity, and the patient was treated then by the doctor with 8 weeks of ceftriaxone, roscefin, it's an infusion therapy, and the patient got completely cured till nowadays. So that patient got cured till nowadays, 10 years free of symptoms. So I cured, not the first patient, but I cured a patient with multiple sclerosis, which is a diagnosis, and all the neurologists, they tell you it's not curable. And this is a shame. If you can cure that, you give the patients options. Not every multiple sclerosis patient has now Lyme disease, maybe some other infections we talk later about, but that's wonderful.
We have a close connection between dental infections and infections of Lyme. We see in our Lyme cases a huge improvement by pain patients or other disorders when we make a proper treatment of infections of the jaws. That means we take out teeth which are infected, we clean the jaws, the bone of the jaws, and a special thing is that we now know that there are infections inside the jaw which are behind the last teeth, the wisdom teeth, and those infections you don't necessarily have pain there. You don't feel anything in your jaws, but you have there a osteitis, chronic osteitis, which makes a lot of complications, infectious complications, and when you remove those infections inside the jaw, also the pain of the Lyme is better afterwards.
I'm a traumatologist, but I have so many problems with patients with joints. Then I tried to come to the reason of these infections. And then I got Borrelia by myself. I could not work 2 years. I was stiff on my left arm and had swollen joints, and also my eye was not working well on the left side. With therapy I could begin work again. I could not work, I could not go upstairs, I have no power more, and it was terrible. And now I know when patients tell me the symptoms, what these really are. I think always all doctors should have a Lyme disease before, then they will believe in the patients.
I went to my nephew's wedding in September '95. I'd been perfectly healthy before then. Set dance, line dance, and I did the mini marathon that year, and I came home and I was just very sick, and no one could find what was wrong with me. So I had flu-like symptoms and tummy ache and small joint pain, and after attending the doctor regularly, 15 months later I got Bell's palsy, which is paralysis on my face and affected my swallow, and I have very sensitive eyes. My senses were affected. After 8 years of going from infectious disease specialist to neurologist to rheumatologist, I borrowed money and went to Switzerland in 2003 to be diagnosed by Dr. Maher, and I had tests done in Basel Hospital, which told me that I had vasculitis in my brain and I was at high risk of stroke, and I had mycoplasma co-infection as well. So with the support of my GP, I got some type of treatment and my health improved a little bit, but not. I never made a full recovery because I didn't get adequate treatment.
But I had a classic bullseye rash. I went to both a pharmacist and a GP. I was put on steroids for the rash, and I was told it was quite normal to get a rash like that. So I decided I'd look into it a little bit further because I was starting to feel unwell. And I went to a travel doctor, and I had a test done. I went to France and it came back negative. And I had nerve conduction tests done to rule out MS. Eventually then I was told I had fibromyalgia. Very hard, but you tend to put things down to what you're doing every day. Like if you've got pain, oh, it's because I was driving so long in the car, it's because I was doing this, it's because I was doing that. Different things like that, until it got to a point where I was getting severe muscle spasms in my back and I couldn't stick the pain. So we went down the Lyme route again, had tests done in Ireland, came back negative. Again, I met a girl in Athlone, Carol Galvin, who was diagnosed with MS. It turned out she got Lyme, and she advised me where to go to get blood tests done through Germany. And ended up, I couldn't walk up or down the stairs unaided. I was sleeping 17 hours a day, I couldn't brush my teeth. Coordination, balance, everything was gone, severe pain. Eventually then I found, through Germany, I found the clinic had just opened in Czech Republic and went there and haven't looked back since. Like last year I was on a walking stick. I mean, this year I haven't had to touch it at all.
I was absolutely crippling up. If I did anything, I would have great energy one morning, and then all of a sudden, you just go into really being lethargic, and not being able to communicate with people. And maybe there was cognitive issues as well, But then I would actually, my joints, it would start in my knees and my ankles and my hips and my back and across my shoulders, and I would absolutely be crippled. I'd be walking around with a brush like this, trying to get from one place to the other. And it was amazing, the pain, like your knee. I said there must be something in there, that's causing that pain. It was just unreal. When I went on the medication after being diagnosed, and my GP was on board with Dr. Armin's findings and everything, within 1 hour, I could feel an improvement. I was able to turn my head right and left, which I couldn't do an hour before that. And the following day, I started improving. And thankfully, I haven't looked back since, in that sense. Now I have to pace myself. I still get, a little bit tight, but I'm still able to work away. But certainly a big improvement.
Thanks to Shirley, I found out I had Lyme disease. She was the one who came to my house and we went through her symptoms. Shirley had been diagnosed 6 months at that stage, and she was in the middle of treatment in Czech Republic. So I got my blood sent to Germany, and I came back with a chronic Lyme and 4 co-infections plus viruses. Well, I'm very lucky with treatment, thank God. He seems to have hit it straight away. I'm on Herbert treatment at the moment and will be for probably another year, because I was going down the route of in bed the whole time and thought it was all in my head. But I had a brilliant doctor as well, and he believed in me, and now I believe in myself. I'm genuinely was very, very sick, and I'm coming out the other end of it. I remember Shirley describing some of her symptoms, and I said, I have that. Oh my God. And it's, people just think that it's, you believe, it's psychosomatic, that you actually, these things aren't happening to you, but they genuinely are. I had about 40 symptoms of, what is there, 60 or 70. I had 40 of them. Heart palpitations, I'm having problems with my kidneys, I'm having problems everywhere, in my body. It attacked all my organs.
My husband Kieran has been unwell, attended his GP since 2008, and he's been to numerous consultants here in Ireland. He's had testing for Lyme's disease here in Ireland, and he's basically been told that there's nothing wrong with him. His symptoms are psychosomatic. He's been offered antidepressants. And then last year we heard Fiona Quilter's story on local radio, and she had been for testing in Germany and the Czech Republic for treatment. So we decided that we'd have Kieran tested last October ourselves. We sent off the kit, and he came back positive for Lyme's. So we've been to the Czech Republic 4 times, and he's started his treatment in January, and he's still on treatment. So prior to that, we have had no quality of life, because Kieran is in bed at 6:30, 7 o'clock every evening. He's chronically fatigued. He has tremors. He's got heavy legs, overall weakness. He's only hardly able to walk. And we have 3 small children. We have twins that are 6, and we have a 3-year-old. So it's been really, really difficult. But thankfully, since March, we can see improvements in Kieran's treatment. So we're hoping that, things will continue to improve. But for us, the most frustrating thing is that we haven't been able to be diagnosed here, and that we have to go to Czech Republic for treatment. It's just horrendous. I have written to the Department of Public Health, asking them about testing and treatment, and so hopefully we're going to start lobbying the TDs, and hopefully we'll get a bit further.
I feel the frustration of the Irish people when I heard that in a year 100 new cases are in Ireland. I don't believe this. You have 4 million or more people, and we in Austria have 7 million people, and we have 60,000 new infections a year, and here only 100 infections. It's wrong. The testing is not in order, and the doctors don't believe in Lyme disease. Reaction must come from the people. They have the possibility to read in internet, in Google, everywhere, and then the pressure comes from the patients to the doctors, and then the doctors must learn.
It's very important to inform the doctors, the GPs, the therapists about what Borrelia burgdorferi can do in your body, to inform about the symptoms, and especially not to laugh about the patients, not to send them to psychiatric, psychological treatments. You have to take the patient serious, and if you don't take the symptoms of a patient serious, you have failed your job. The patients want something, and the majority of doctors, they don't do what they want. Now you can say all the patients are wrong what they're telling the doctors, but on the other hand, the experience by Ignaz Semmelweis 150 years ago showed us that really a minority opinion can be the right opinion, the right way. And in my eyes, chronic infections are completely underrepresented in the medical world. Nobody's looking and accepting chronic infections. The treatment is difficult. Each case is different from the other. Each patient is different from the other. You have always to look for the side effects, for the risk-benefit ratio. But if a doctor decides, yes, I treat the patient, it can be very successful, and the patient can recover if you treat a patient long enough.
I am always afraid to get a new bite, and I'm always afraid that I will be on the same level than for several years. I am happy that every day when I can wake up and stand up without pains.